Today, I would like to talk about the efficacy of treatments of the lower back pain that I have practiced with my clients, um, utilizing the manual osteopathic techniques that I have learned so far. As we all know, low back pain is one of the most common seen complaints we may get from the clients. The reason behind is very apparent. I call it commons are caused by commons. There are many daily activities through our life that could cause impacts to our body mechanic, resulting in low back perception and function disorders, directly or indirectly, such as long term sitting, repetitive back bending, heavy stuff carrying, sports injury, etc. Almost everyone has a great chance of suffering a low back pain regardless of occupation. In different levels of the dysfunction, the pathology may be soft tissue hypertonicity, joint misalignment, or visceral function disorders. As we see the body as a whole, it would be less efficient if we treat only the local lumbar region. Therefore, I assess the dysfunction through the unities 1 to 3 and usually have a better idea of what is focal and may address the issue more accurately to facilitate the better treatment results. So I use Michelle screening and testing a lot in my work, and they helped me a lot with better understanding what I am facing and what I can do to the clients with confidence. Recently, to some of my regular clients, I asked for consent and got to practice some manual osteopathic assessment and treatment techniques to them. I pay more attention to the pelvis and spine accordingly. I have this client, JW, who's a construction worker. He had low back pain on and off for years, and then through the Michelle testing, he's gotten no spinal rotation or side bending, nor pelvis inflare outflare, but high ilium on the left, deep sulcus on the left, DILA on the right, and it gets even in spinal extension. So I knew he'd gotten a SC6 sacral misalignment. So I decided to do the correction for him, and I asked him to lie on the deep sulcus side, which is the left hand side, and I had his hips and knees flexed to 90 degrees, and I palpate the L5 spinal process. And same time, I asked him to rotate his head and upper shoulder to back, and I felt the movement of the L5 spinal process. And I hold his legs above the knee and palpate the deep sulcus. And I rotate both legs up off the table, and I felt the deep sulcus moved. Then I asked him to resist back with 10% of his effort for 10 seconds, which means he was actually turning down to the ground, and I was holding his knees, his legs up off the table. And I repeat this twice, and I asked him to lie back prone and reassessed. I surprisingly got his sulcus and ILA all even. And I proceeded to do the regular massage that I did before on him. I massaged not only the low back, also the hip, the legs, and the shoulders. Yeah, I finished the massage. Well, I call it massage, but it was combined with manual osteopathic techniques. This client was happy with the treatment results, although he did not mention about the help of the manual osteopathic treatments, because yeah, they don't know. And I was happy because I really saw something. I saw some structural change, and I provided the relief to the clients. So this is where my confidence comes from. And I had this client too, JY. She's a dentist who sits all day with arms, hands busy all day. And she came over to me usually for either shoulder pain, shoulder soreness, or low back soreness. So this time she came over with the low back complaint plus the shoulder soreness complaint, but the low back complaint was the primary. And I assessed her with the Michelle screening and testing, and I got her L2 to L4 spinal rotation to the left. There was no in-flare, out-flare in the pelvis. There is high ilium on the right, deep sulcus on the right, DILA on the right, which is SC1, sacral misalignment. And I proceeded to do the SC1 sacral correction. I had her lying facing down, knees to the edge, to the end of the table, and I was standing in between her legs. I asked her to relax the tummy to the table, relax the gluteal muscles, and I had her right leg abducted until I felt the sulcus movement, and I had her head turned to her right and relaxed the upper body, and with the right, my right hand, the thenar region, and I push the DILA up, and for about 10 seconds. Meanwhile, she was asked to take deep breaths, and I repeated this 2 times with a full relax in between. And then I reassessed. Yeah, she got the sulcus and the ILA even. And I asked her to sit up at the corner of the table with the knees against the table edge, and with the stool for her to stand, to relax her both feet on. And I was standing on her right side with my right arm holding across to hold her left shoulder, and I had her sitting slouched. Oh, because the left rotation of the L2 to L4 was found in flexion. So I had her slouch, and I turned her trunk to the right, to the left at the waist, and I push with my palm on my left hand on the left transverse process of the L2 to L4, and I asked her to give me feedback if that hurts, and she said, yeah, it was a little sore, but okay. And I had I got to hold the pressure onto the left transverse process, and I was feeling the softening of the tissues. And that was quite a period of time. It was about like a minute, and I felt the soft tissue was softening, and I had her back to neutral, and then I repeated this 2 more times, and I reassessed. I got the like instantly. Well, this is a few minutes after, but it was quite instant. I got the results. The rotation was corrected very efficiently, and I followed with the massage that I regularly do to her. She was very happy this time. She said, "Oh, this was a different experience, and this time it felt even better about her like easier about her low back, and for sure for the shoulders I massaged the muscles, and then she got the shoulder relaxed as well, and I feel really happy. I got like this really happening. I got more tools to treat my clients. I got very good turnouts, and I feel like this is actually probably more on the manual osteopathic treatment side, because I I realized that we also do myofascial uh, remodeling. We also do a lot of work just as massage therapists. This is where um, I feel like my confidence comes from. So through the I call it combination treatment, which I combined the manual osteopathic techniques and massage techniques together. I found with the assessment, I found I saw more SC1, very common on my clients, and I did many SC1 correction. I got very good turnouts, and I also want to mention something kind of interesting to me. That is, earlier when I just started to bring the manual osteopathic techniques in my practice, I did not remember clearly what to do to the sacrum. Um, I focused on the sacrum a lot, right? I kind of got confused um, of from SC1 to SC2, SC5, SC6, and what I did was actually I applied SC1 correction to all of those DILA cases. And interestingly, I found they all worked. I guess the reason behind is like because I do massage before and after the manual osteopathic correction. I have already gotten the soft tissue softened. I've gotten the joint softened, loosened. I mean, um, so as long as I'm pushing the DLA to like up to the right direction, I still got got the dysfunction partially corrected. Well, I guess that's probably not the best thing to do. So I have to consolidate my skills and knowledges from the manual osteopathic therapy, and there are more coming. There are myofascial remodeling coming to like this month. I'm looking forward to learning more, so I could bring even more manual osteopathic techniques and assessments into my practice to benefit my clients. And to be honest, manual osteopathic techniques had made me feel easier about my work, because doing massage is kind of boring, like spending 1 hour on like kneading the soft tissues, pressing, like applying pressure. And I also got recently some clients very good feedback right after the treatment. They said, yeah, they got a very different massage experience, and I feel really happy. They also gave feedback like the treatment was very effective. Yeah, I want to say I need to learn more. I feel passionate to this manual osteopathic therapy. Thank you very much.